Hello, I'm Dr. Mark Lorenzato. This video is about common acne, acne vulgaris. I can help you get this under control, but you'll have to pay attention to your diet. Acne is a disease of inflammation frequently fueled by diet. We don't have a lot of time to go into diet, but the model of nutrition has changed. It's no longer about the Mediterranean diet or the Atkins diet. It's now looking at our paleo legacy and seeing what we used to eat and how things have changed. Primarily, let's look at the oils that you would have gotten from eating meat before agriculture. Game animals are high in DHA and EPA. Those are the omega-3s we frequently get from fatty fish now, or that you have to supplement with. But regularly people would eat meat to survive. Once every week, once every 2 weeks, a good amount with DHA and EPA. Now you're not getting it. And you're competing for those critical oils with many other refined oils, such as corn oil, safflower, sunflower, cottonseed. You need to cut down fried foods, avoid those, have a little bit of them, not so much. You need to be getting your oils from the foods, from the vegetables, from the nuts, not from refined sources. Sodium is not a big player in acne, but it may contribute some. I see that people get too much sodium in their diet, not enough calcium, part of how we've shifted. Cereals are very high in phosphorus, phosphate, and low in calcium, so we're getting less calcium in our diet because we're a cereal happy crew. Cereals also can contribute to acne because they're high glycemic index. Glycemic index means they turn into sugar in your bloodstream readily. The sugar fuels Propionibacterium, the bacteria that feeds acne. So basically, we want to stop feeding acne by cutting back on the sugary foods, the foods that are high glycemic index. We want to change the oils that we're eating and not get our oils from fried oils. And we don't want to be getting too much dairy products because those also have more saturated fatty acids instead of monounsaturated and polyunsaturated fats. So we limit our dairy. We eat game meat if we can, fish. Range-fed meats are much better than lot-fed meat, more expensive, much better. And if you can't get these, then you may need to substitute with the things you're missing. DHA and EPA, the essential omega-3s, conjugated linoleic acids. Both of these have proved to be beneficial. When people are absent, when they're lacking of these, when you return them, their acne gets under control. So I don't know if you're the regular person out there, you're not getting enough DHA, you're not getting enough EPA, you're not getting enough conjugated linoleic acids, you're getting too much sugar, you're getting too much starch, you're getting too much refined oils. That's the nutritional side. Looking at specific foods, beta carotenoids, the things that make carrots so lovely, so beautiful in color, and other fruits and vegetables brightly colored, beta carotenoids get turned into vitamin A in our body. If you're not getting enough beta carotenoids from your food, then you have a weak innate immune response. In other words, your skin can't keep bacteria off of it. The innate immune response, a good part of it is having these beta carotenoids, which turn into vitamin A, which keep the bacteria from invading your skin. So is there need to be referred to a dermatologist so he writes you for some vitamin A? Not if you can get it through nature, through your beta carotenoids. Next thing was the low glycemic foods are much better. It means you're cutting down on the starch and sugars. That includes drinks, that includes orange juice, that includes sugary juices. Next thing is you're going to do the omega-3s and the conjugated linoleic acids if you can. Next, histamine-rich foods can contribute to flare-ups. Go to the internet, look at what foods are high in histamine. You may need to avoid some of these. And some of these are in conflict. DHA and EPA may be in high histamine-released foods. So you mitigate it, you see what works for you. You try to limit inflammation by not rubbing, not scrubbing. You try to be very gentle. Next thing, lauric acids in coconut oil. I wouldn't recommend putting it on my face, but if you have acne someplace else, you might try it. It's got good bactericidal. It kills bacteria. It's been known to be somewhat beneficial. Now, benzoyl peroxide may be what you can do yourself that gives you the most immediate results. I'm not saying dismiss nutrition, but benzoyl peroxide works. It takes several weeks to get up to a treatment regimen that works without the inflammation that goes with it. In other words, it causes a little inflammation at first. There is a sequence. You want to wash your face with plain water, not touching it in the shower or splashing it on. You want a gentle wash with what I prefer is baby shampoo, something very gentle to wash the face. You need to let it air dry. Apply the 2.5% benzoyl peroxide. No need to use anything stronger than that. You're going to start with a very small amount, but you're going to apply it twice a day, and you're going to work up to a whole teaspoon twice a day. So at first you're going to use maybe a quarter or an eighth of that, and every 3 days work your way up, avoiding the eye region. Then, after the benzoyl peroxide dabbing dries on the skin, you're going to use a good moisturizing screen and dab your face, just dab the area and moisturize it. Without the moisture given back that's taken out from the benzoyl peroxide, it will be irritated. So, benzoyl peroxide twice a day, gradually build up the regimen over 2 weeks, follow the cleanse, the rinse, cleanse, apply, and then moisturizer plan, and we'll try that. Benzoyl peroxide is over the counter. Other therapies might work, include steroids occasionally like prednisone if you've got a lot of inflammation or if there's another disease process going on that's fueling the inflammation in your skin, because once inflammation's in one part of the body, it can cause white cells to cause inflammation everywhere. So we need to talk about that. Occasionally we can use non-steroidal anti-inflammatories. Sometimes they work under some circumstances, and that's aspirin occasionally, ibuprofen occasionally, naproxen occasionally, frequently as creams. In women, particularly oral contraceptives can be good at harnessing or suppressing some of the hormones that fuel this, particularly the testosterone, as well as spironolactone, predominantly used in women, because it will decrease the testosterone, and particularly in women with facial hair problems or obesity, the spironolactone can be very beneficial. If a woman has polycystic ovaries, managing that problem, maybe with metformin or something else. So these are conversations we need to have, whether you need something else. In summary, I would like you to do a food journal and bring it to me of 3 days food to see what you have at risk for having acne, and then we can work at understanding how we can resolve that. You can use benzoyl peroxide and food both to manage common acne. And if we can't get it resolved, I'm going to ask you to see a dermatologist to see if they can contribute to your solution. So tretinoin, once again, is vitamin A. That's what the most likely thing the dermatologist is going to write. But you can also get that in your system from eating beta-carotenoids. A little bit of orange juice, a little bit of carrot juice, not a whole lot, but a little bit every day could be a major changer. Thanks. Hope this helped. Talk later. Hope this sparks a good conversation with you and me or a different health practitioner.